Hi everyone. So this week we are going to move into assessments. So we talked about goal setting and using a SMART goal, and now we're going to move into the next part of programming exercises. We have to assess someone. We have to see, where is their starting point, and that way we can go from there to build them an exercise program. Here are our learning objectives for this segment on assessments. Learning objectives are a good starting and stopping point for you. How comfortable are you with these learning objectives? If you're not comfortable with some of them, that tells you should go back and review them before you take a quiz or an exam. So let's go ahead and take the next couple slides and review how to assess whether or not someone has created a SMART goal. Right, so before we ever assess someone, we're going to talk to them about their goals. So you can read over the case study here about Jack, and then I want you to identify whether or not this right here is a SMART goal, right? Is that a SMART goal? So what you can do now is you can pause the lecture and review this as a case study. Does what I've circled here meet all the criteria for a SMART goal? And if you can't remember what a SMART goal is, S-M-A-R-T, be a good idea to go back to our previous lecture and review that. And then assess whether or not Doug has a SMART goal written here. Sorry, Jack. The next slide is Doug, right? So I'll go ahead and put myself away for a second. Here's Doug. This is another case study. Is this a SMART goal for Doug? Knowing what we know about Doug, you can read right here, CFO at Kroger, former long distance runner, blah, 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 and then read all that for yourself. Pause the lecture and go back and review what a SMART goal is, and is this a SMART goal for Doug? Does it meet S-M-A-R-T? So now let's go ahead and get into our first assessment. So our first and simplest assessment that we should always perform on someone is what level of exercise are they ready for? What level of physical activity can they start doing right now? Right? So we use a flowchart, that I'll go over with you to designate the level of intensity someone is allowed to work at right now. And to do that, we have to be really comfortable with intensity. And we talked about how to measure intensity, right? We have talked about light, moderate, and vigorous intensity. We haven't necessarily talked about these categories, but we've talked about, whoops, sorry about that. Let's erase that. Oh, tried to erase it. How about that? Still getting the hang of this new PowerPoint stuff. It's pretty cool though. Sorry about that. So categories for intensity: light, moderate, and vigorous. So in these categories, you'll see the tools that we've already used. The heart rate reserve and the RPE designates these different levels of intensity, right? So 30 to 40% of that heart rate reserve, or an RPE between 9 and 11, designates someone would be exercising in a lighter intensity. If we jump down to vigorous intensity, anything above 60% heart rate reserve or an RPE at 14 or above would be considered vigorous intensity. There's also a subjective way that we can measure intensity. Slight increases in heart rate and breathing, that would be something that information someone would give you, right? That would be something that someone would say to you, hey, my heart rate is, it's getting up just a little bit, slight increase. Is it noticeable? Yeah, my heart rate's definitely starting to get up. Okay, we should say you're about moderate intensity, and then we check what your RPE is. It's somewhere around, 12 to 13. Okay, you're at moderate intensity. If we had a heart rate monitor on, we had an Apple Watch or something like that, we could measure a percentage of their heart rate reserve while they're exercising, or we can do it manually, right? You can take it at the wrist. Um, so, um, that is how we categorize intensity of exercise. So we're going to use the process that I'm going to describe in the next slides to designate whether or not someone is ready for light intensity, moderate intensity exercise, or vigorous intensity exercise. One of the biggest keys, though, and our biggest starting point here is deciding, are they currently exercising? Are they currently exercising? And that qualification is described as someone completing 30 minutes of moderate physical activity or exercise. So look down here at moderate, right? This would be here, right? So they have to be at least 40 to 60% heart rate reserve, or completing some type of activity, exercise, physical activity that would put them somewhere between 12 and 13, or an intensity that causes noticeable increase in heart rate. So they have to be completing at least 30 minutes of moderate intensity physical activity or exercise 3 days a week for 3 consecutive months. Oh, I started exercising last month. Okay, great. You still don't qualify as someone who we would consider has been currently exercising, right? So that's a category we really need to be familiar with, and we'll see why. Okay, so here's our first step. First step, we need to identify someone. Have they been participating in moderate intensity exercise or physical activity for 30 minutes a day, 3 days a week for the last 3 months? Reminder, moderate intensity, 12 to 13 RPE, 70 to 80% heart rate max. Now that wasn't necessarily on the last slide, but that is the equivalent of our 40 to 60, sorry, this is kind of crappy, heart rate. I think you see where I'm going here if you check back on the previous slide. All right, looks like a kindergartner wrote that, but I think you know this 40 to 60% heart rate reserve is the same thing as 70 to 80% heart rate max. Remember when we talked about intensity, there's different ways to designate intensity. Heart rate reserve is the best. Percentage of just straight heart rate max is okay too. So remember, moderate intensity, right? And then are they doing this moderate intensity for 30 minutes a day, 3 days a week, or for the last 3 months currently? Yes or no? All right, so yes, they can continue with moderate exercise and incorporate more intense exercise gradually, or no, they may begin with light to moderate exercise, progress gradually to more intense exercise. We're going to break these down even further, right? So let's go ahead and do that now. First, we have to decide yes or no. Are they currently participating in physical activity or exercise at a moderate level? Yes or no. Okay, that's our first step. Our second step is that we need to designate a few things about their current condition. One of which is, are they currently diagnosed with cardiovascular disease? That would be something that would be diagnosed by a doctor. Do they currently have type 1 or type 2 diabetes? And are they also dealing with kidney disease? Do they have kidney disease or renal disease? Is that something that they're dealing with as well? They could have all three of these. Unfortunately, there are people that are dealing with all of these. And then we break it down even further. Are they displaying signs or symptoms of cardiovascular disease? So we really need to see where someone's at cardiovascularly before we start programming exercise for them, especially different intensities of exercise. So obviously, if we just jump someone into vigorous exercise and they're showing signs or symptoms of cardiovascular disease, or they currently have cardiovascular disease or any one of these conditions up here, you could be putting them into a dangerous situation. So signs or symptoms of cardiovascular disease, right? A sign is something that you can see on someone, like you can actually see that their face is turning blue, or that they don't have any color in their face, or you can see that their limbs are swelling. A symptom is something that they describe. My chest is hurting, my jaw is hurting, something like that. So signs are something you can actually see with your eyes. Symptoms are something that someone will describe to you. Discomfort in the chest, neck, or jaws, shortness of breath, dizziness or lightheadedness, trouble breathing when sleeping or laying down, ankle swelling, painful swelling in the limbs, heart murmur, or a faster than regular heartbeat, which is also called tachycardia, right? So one of the biggest things to remember about this group of signs or symptoms is that you would be talking to someone and you would ask them, do you have these signs or symptoms right now while you're resting, or do they even pop up when you're doing activity? So signs or symptoms are an important part of understanding what intensity level someone is ready for. Also, there are current known conditions that would be diagnosed by a doctor. All right, so now we talked about asking them the first question. Have you participated in moderate intensity exercise for 30 minutes a day for for 3 days a week for the last 3 months? And on this slide, we're assuming that the answer has been yes. Then we have one of 3 paths we can take to our next question. And that has to do with our known conditions and our signs or symptoms. On the very left-hand side, we are asking, you said, they've told you they don't have any conditions that have been diagnosed by their doctor, no cardiovascular disease, no type 1 or type 2 diabetes, no renal disease, right? They don't need any medical clearance. They can continue with moderate or vigorous intensity exercise. They're good to go because they've already been exercising. They don't have any known medical conditions, no signs or symptoms. They're just would be like a lot of folks in our class, more than likely. Just continue doing what you're doing and you can do whatever intensity you want. Then we go to the middle and things get a little bit more complicated. Their doctor has said they do have a known condition. They've been diagnosed with cardiovascular disease, type 1 or type 2 diabetes, or maybe some problem with their kidneys. But they're not showing any signs or symptoms. They have been exercising. So if they wanted to do moderate intensity exercise, right? If they wanted to do moderate intensity exercise, medical clearance isn't necessary. They're good to go. If they want to do vigorous intensity activity, right? If that is what they want to do, and they haven't been to the doctor in 1 year, they need to go. Okay? You have a known condition, something you've been diagnosed with, and you want to start vigorous intensity activity. You got to go to the doctor if you haven't been in a year. And then you're good to go if they say you're okay. Continue with moderate activity, progress to vigorous. So this is kind of a dovetail here, or depending on where they're at, you choose the path that's most appropriate. Okay, so the last one here. If anyone who has been exercising and has any signs or symptoms that might suggest they have cardiovascular disease, chest discomfort, painful swelling in the limbs, that list on the last slide, Any of those. If they say, yeah, I've been exercising 30 minutes a day, 3 days a week for the last 3 months, but they tell you they have any of these signs or symptoms, regardless if they have any known condition, if they have any signs or symptoms, they need to stop. They need to stop exercising right away and go get a doctor. Go see the doctor, right? So why is that? That's something we really need to pay attention to here. This is the really special case, right? On this slide in particular. What we have to assume and what we know is that exercise, if someone's exercising, exercise is a medicine, right? So it helps a lot of things. It should decrease the likelihood that we have any signs or symptoms, right? It should help our cardiovascular fitness and our cardiovascular health. It's going to lower our blood pressure. It's going to do a lot of things. It's going to help our nervous system. So if someone's been exercising for the last 3 months, 3 days a week, 30 minutes a day at moderate intensity, we should assume that even if they have a known condition, if they're able to do the exercise, they shouldn't have any signs or symptoms. If they do, we're assuming that the exercise is not making things better. It might be making things worse. Bad news, stop right away, go to the doctor, all right? And then at the very bottom right-hand corner here, you say if they get cleared by their doctor, then they're good to go, okay? But hopefully in that situation, if they're still having issues after having been exercising and they go to the doctor, they'll get something figured out, right? Because there are certain instances where exercise can make things worse. So we want to make sure we're not putting people in that situation, or that we get them to the doctor if we realize that. Okay, so here we're looking at the opposite scenario. The very first question has been answered, no. Have you participated in moderate intensity exercise for 30 minutes a day, 3 days a week for the last 3 months? No, I haven't been. The nice thing about this process that we're talking about is it tries to eliminate as many barriers as possible to getting someone to increase their physical activity, right? So we start over again. No, I haven't been, okay? I just started sort of doing exercise the last couple weeks. But let's go over to the left. But I don't have any known conditions. I don't have any signs or symptoms. You don't need medical clearance. You're good to go. Start light or maybe moderate intensity exercise. Start adding on little by little. Go to the middle. No known conditions. You're not diagnosed with anything. You're not showing any signs or symptoms. Probably a good idea to go to your doctor. Okay, it's recommended. It's not required, but it's still a good idea to go get a checkup from your doctor. Make sure you're okay to start light or moderate exercise. And then after they go to the doctor, good to go, light to moderate exercise, right? And we're assuming in these instances, even if they haven't been doing exercise, we're just kind of adding on little by little. We're not just throwing them into vigorous intensity exercise. If you have someone who hasn't currently been exercising, right? They're not exercising, and they have any signs or symptoms. Now, this is where it's different from the last slide that we talked about. It's reasonable to assume that someone who doesn't exercise and doesn't meet the minimum recommendation of 30 minutes a day, 3 days a week for 3 months, it's reasonable to assume that someone like that might have some mild signs or symptoms because they're not exercising, they're sedentary, right? Good idea to get medical clearance. It's recommended, heavily recommended, not required. You could program exercise for that person at a light intensity without them seeing their doctor right away, but it is definitely recommended, okay? And we should assume at that point that any exercise is just going to make things better for them. And if it doesn't, then obviously go back to the doctor. So this is, these flow charts are tools that we're going to use to assess someone's readiness for exercise. And I'll post these on Moodle, and we're going to use them in class assignments and in lab. So you just follow the flow chart, right? Which one are they? Are they the person, if we look to the left, are they the person that's currently exercising, meeting the minimum recommendations? Or to the right side, no, they're not. And then you follow the path that most clearly represents the information they're giving you. Any signs or symptoms, known conditions. Then obviously in the very bottom right-hand corner here, I have, it might be a little bit harder to see on the PowerPoint, but it'll be a lot easier on the actual document, designation of intensity levels that we talked about. Okay, so our exercise readiness, right? Our exercise readiness assessments we talked about. Now we're going to talk about different categories of assessments that some of you might be familiar with. There's cardiovascular, there's muscular fitness, there's flexibility and mobility, there's locomotion, and other health assessments. There's so many different ways to assess people. In the upper left-hand corner, if we look at the cardiovascular, submaximal and maximal ergometer tests, those are just like treadmill testing, bike testing, Vo2 Max testing, lactate threshold testing to see how intensely you can perform without developing a lot of lactic acid. Stress testing is clinical testing, right? Muscular fitness, we'll talk about some muscular fitness tests. Strength for 1RM. 1 rep max is a very classic assessment. Power testing, jumps, vertical jumps, and muscular endurance, like just how many reps can you do or how long can you go. Then we have flexibility, range of motion testing, how tight are some of your muscles. I'm going to move away. This refrigerator just kicked on, so it's probably a little loud. I'm going to move over. Sorry about that. Lots of different mobility testing protocols that we could talk about. Could do a whole class on those. Then there's agility testing, sprinting testing, all the stuff that you see that is done at the NFL Combine, could call locomotion testing, just how fast are you and what direction are you going. And then there's tons of other assessments. You can assess somebody's current nutrition. You can assess their body composition, their sleep, their level of stress, all different. We could do a whole class on just assessments. We're not going to do that. We're going to talk about some specific ones this week and get you familiar with some really basic ones. So the cardiovascular assessments, right? The cardiovascular assessments, I went a little bit into this on the first slide. There are lots of different cardiovascular assessments, some of which we'll do in class. There's ergometer testing. Ergometer is just a fancy word for a treadmill or a bike, right? So there's sports testing. I think some of you have probably done the beep or the shuttle testing, Vo2 Max testing, and lactate threshold testing. How well can your body deliver oxygen, and how quickly is it going to develop lactic acid at different intensities? Because lactic acid doesn't cause fatigue, but it's a sign that fatigue might be on its way. And then clinical stress testing is doing hospital testing on the heart, usually on a treadmill or a bike. Muscular fitness testing. We can test for strength, power, or endurance in the muscles. Strength is how much force can your muscles apply. 1 rep max, 5 rep max, or a hand grip test. The hand grip test is the one that we're going to do in class, and you're going to learn how to do that. Power, how quickly can your muscles apply force. Jumping, throwing, Olympic lifts are a great measure of power. So not only how much force can you develop, but how quickly can you do it. And then muscular endurance testing. How long can your muscles apply force for an extended period of time, over and over and over again? The test we're going to look at in class is the classic push-up test. Always a great test to use for muscular endurance. And then, of course, like I said before, so many different range of motion tests. For joint range of motion, muscle tissue, length and tension, movement patterns and compensation. So how well can you move your joints? Goniometry is an assessment I know that you learn in Introduction to Exercise Science. Clinical techniques for tissue and length of the muscles, which can definitely affect movements, massage, deep tissue manipulation. For those of you who are going into physical therapy or occupational therapy or athletic training, you'll learn all about that. And then movement patterns and compensations. A couple of these we will do in class. In Introduction to Exercise Science, you do get introduced to the functional movement screening. We'll look at a couple of those in class. We'll actually look at something called functional capacity testing, which is really cool. And then there are tons of movement screenings out there that people sell online for different types of populations, all sorts of things that we can do to assess somebody's mobility, flexibility, joint range of motion. Locomotion, sprinting speed, straight line speed, that could be using just straight running. That could be getting on a bike. That could be getting on a treadmill. That could be an arm ergometer. The arm ergometer is the thing we have in lab, in the back of the lab where you go like that. So that could be a good locomotor test. Agility is the ability to change direction. So if you're running one way and then you cut back and you run the opposite direction, that would be agility. So some of you might be familiar with a lot of agility drills, the 3-cone drill, the pro agility drill that they do at the combine, all sorts of drills that we have that we could do to test someone's agility, their locomotion. All right, so that ends our lecture on assessments. I want to come back to the SMART goals that you guys were looking over, right? So is this a SMART goal? It gets really, really close, okay? The one thing that it's probably missing is a couple of different points on measurable. So when we wrote it down, it said we would like to be at 190 pounds for Jack by Christmas. Well, what's today's date, right? We have no idea where we're starting from, so how can we know, how to program exercise for this person out to Christmas, okay? So if you don't know how long someone has to achieve their goal, then it's not really measurable, right? So that's one thing that I would critique on this one. If we're looking at this one here, this one is super specific, right? This meets SMART, specific, measurable, attainable, realistic, and timely. This meets all those components, and I know it looks huge, the write-up here, but this is how you get a SMART goal, all right? It doesn't have to be this long, no, but if we're using all the tools available to us as an exercise scientist, when you write out a SMART goal, you can get pretty specific. And there's lots of different assessments that you can use, right? So that's a review of the SMART goals. That's the end of our lecture on this segment. Let me know if you have any questions, and I hope you have fun.